The clock drawing test, or the CDT for short, is one of the most widely used cognitive screening tools. It was designed to help healthcare professionals get a sense of how severe a person's suspected symptoms of cognitive impairment or dementia are by having them perform a simple task. That simple task is to draw a clock. It's a simple way to take a look at a person's ability to perceive instructions or directives as well as test how strong their memory is. Despite it being a simple task, small mistakes can point to a number of things. Some of the symptoms that it aims to assess are their capability to understand simple instructions, their short-term memory, their ability to maintain concentration when working on a task, the strength of their abstract thinking abilities, and their spatial orientation. The best time to administer this test is during the initial sessions that you have with your patient. These are the sessions where you are still trying to gauge them based on the suspected symptoms or disorders they are reported to have. Since the clock drawing test is a cognition-related screening tool, the following health professionals can use this for their work: neurologists, neuropsychologists, geriatricians, psychologists, psychiatrists, and primary care physicians. To use our free clock drawing test, follow these steps. Download our clock drawing test from the CarePatron platform, which you can find in the link in the description. The healthcare professional must prepare a sheet of paper with a big pre-drawn empty circle in the middle of it. Once the sheet of paper with the pre-drawn circle is ready, the healthcare professional must instruct the patient to write down all the numbers on the clock in the way that they are normally arranged. As they are writing down the numbers, you must observe if the patient is able to take into account the symmetry of the clock. Another thing you must take note of is whether they leave out certain numbers, if they write numbers past 12 or if they repeat numbers. After writing down all the numbers of a clock in the circle, tell them to set the time to 10 minutes after 11 or something similar. The instructions are meant to check on how they are able to interpret instructions or directives. This guide uses the Schulman clock drawing scoring system. 0 equals there is no reasonable representation of a clock. 1 is that there is a severe level of disorganization based on the scoring criteria for 2 points below. 2 is that there is a moderate visual-spatial disorganization of time such that accurate denotation of 10 after 11 is impossible, and the clock has any of the following. 3 is inaccurate representation of 10 after 11 when visual-spatial organization is perfect or shows only minor deviation, and the clock drawing has any of the following. 4 is only minor visual-spatial errors were committed by the patient, and 5 is that the clock drawing has no errors, it's a perfect clock. Here is a sample of our clock drawing test, which you can find on our CarePatron platform. To find our clock drawing test, go to our CarePatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at CarePatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our CarePatron channel or click on one of our recommended videos.